My name is Tammy Wood, and I'm the Executive Director for the Chalmers Hospital Foundation. And this year we are raising money for our intensive care unit. Our campaign title is ICU Making a Difference. This year we'll be raising $600,000, and that is in partnership with the Hospital Auxiliary. When you visit the coffee shop or the beauty salon or the gift box, a percentage of the sales will be going towards the intensive care unit. All funds raised through the Hospital Foundation come back directly to the hospital, and this year it'll be for the ICU.
My name is Kelly Landers, and I'm a registered nurse in the intensive care unit.
My name is Marisa Chase, and I'm a registered nurse in the intensive care unit.
The type of patients that usually come to our unit have life-threatening conditions, diseases, infections, and these patients require breathing machines and/or life support medications. So every patient's hooked up to our cardiac monitors. That way we're able to keep an eye on all their vital functions. And we're able to view what's going on with the patient at the bedside and at our central monitor. Patients who come in to the intensive care unit are of all ages, including children.
Through these monitors, we watch heart rate, blood pressure, oxygenation level, respiratory rate, and the monitor's alarm to let us know when something is out of the norm. These monitors are outdated, and the equipment that we have for them, some of it is broken, some of it no longer works, and some of it, pieces are broken. So we desperately need new monitors.
My name is Dr. Aslam. I'm the medical director for ICU in Dr. Everett Chalmers Hospital. As you can see, our old monitors are about 10 to 12 years old. They are outdated in technology, and the vendors who are servicing these monitors do not provide any further services for our current monitors. The new monitoring devices, the technology has improved in the last 20 years, in which we have better ways of monitoring patient status and response to therapy, and making more accurate diagnosis in their life-threatening diseases. And that's why the new monitoring system and new monitoring devices will help us optimize patient care and improve patient outcome. I want to mention one of the cases that we deal with in our ICU. His name is Murray. He was involved in significant complication from his medical disease in which his life was threatened, and he was on life support and under our care in our ICU, and he survived his illness and is doing very well right now.
My name is Murray Grass, and I grew up here in Fredericton. I deteriorated all weekend, and through that next week I just kept getting worse. And Saturday there was a decision made that I needed emergency surgery to drain the fluid that had built up around my heart. Partway through it wasn't working, so it was decided that I needed to have another incision in my back to drain the fluid from around my heart. After the surgery I was in the ICU in critical condition. You know, the skilled doctors like Dr. Islam and the nurses of the ICU, and the amazing job that they did to keep me alive, and how they know from one beat to another what that machine is telling them. I truly believe that I wouldn't be here without that, without the equipment. You know, I think the staff have wonderful gifts of patient care, but they rely on the equipment to make decisions, and we need help.
Thank you for making a difference.
Thank you for making a difference.
Thank you for making a difference.
Thank you very much for making a difference.
Thank you to the staff of the ICU for giving me back to my family. I know you made a difference. Please give.